All right, so today we are talking about assessment, clinical assessment. So what is psychological assessment? With psychological assessment, our goal is to collect, organize, and interpret information about a person and his or her situation. So to arrive at a clinical diagnosis, we need a clear picture of the symptoms that this person is experiencing. And we gather that clear picture by using assessment techniques. Why do we use assessment? Well, first we want to provide some kind of description. We want a description of the person's personality, their cognitive functioning, how are they thinking, their overall mood, and their general patterns of behavior. Assessment also has the goal of predicting. So we want to be able to predict how an individual's future behavior might play out based on how they are functioning right now. So assessment then is an ongoing process. It's not like you just meet with the individual one time and then come up with a diagnosis and you never try to assess this individual's difficulties again. Assessment is something that should be done repeatedly because the individual's problem might change. Their situation might change over time. There are some potential problems that can exist within conducting assessments. So first, the manner in which the assessor conducts the interview. So errors in interviewing may lead to inaccurate results. So for example, if you don't ask enough questions, you don't gather enough evidence, you might misdiagnose a client. If you don't have rapport with a client, the client will likely not be comfortable sharing really intimate details. The manner in which the assessor interprets the evidence. So for example, we all have biases, right? Particular ways of thinking. Perhaps your theoretical orientation influences the way that you interpret this evidence. And then lastly, we have pragmatic considerations. So these are the practical considerations. You might have very limited resources. Multiple assessments are best, but you might not have the time or the resources to actually be able to spend hours with a client, interviewing the client to get the best idea of what's going on. So there are multiple ways that you can conduct assessments. The most common is probably the interview, a face-to-face conversation between the subject and the examiner. An interview can be a very structured session where you're gathering information, collecting data on the individual's life situation, their personality. You want to look for verbal and nonverbal cues. So you want to know what are they saying, but also how does this person relate to other individuals. A very quick way to conduct a basic interview is by doing what's called a mental status exam. And a mental status exam is this very, very broad examination aimed at turning up any signs of a disorder. So for the mental status exam, you're going to be looking at 5 different areas. So first, the individual's general appearance. Did this person show up looking relatively put together, or is this person very disheveled? You want to know about the individual's mood also, right? How have you been feeling most of the day? We want to know about that. We want to look at your thought process. Is your thinking logical? Are you expressing yourself in an organized manner? Or is your thinking kind of all over the place and tangentially related? We want to know about cognition. Are you aware of where you are? Do you have an orientation? Do you know that, this is 2013, 2014, whatever the year is? Do you understand that you are in an office talking to someone? We want to know about those things. And then lastly, we want to know what kind of insight does this client have? Does this client have any kind of self-awareness? Does this client understand the particular symptoms that the client is experiencing? Psychological tests are another way to conduct assessments. So with psychological tests, these are usually standardized procedures. So that means that every individual gets the same instructions, the test is scored the same way, and the environment is the same as well. And the advantages of doing this standardizing the test is that it minimizes the likelihood that bias is going to play into interpreting the results. And it ensures that the results are due to the attributes of the test taker, not to extraneous environmental factors. Additionally, these standardized tests are normed, so you can compare individual performance to the average group performance to make inferences about the person's underlying attributes. With psychological tests, we may also choose to use a psychometric approach. People who adopt a psychometric approach are looking at some kind of stable underlying characteristics or traits, and they assume that these particular traits exist in differing degrees in everyone. So if you remember taking a social psych or personality psych course, and you probably learned about the big 5 personality characteristics, so conscientiousness, agreeableness, neuroticism, openness to experience, and extroversion. Those are dimensions of personality, right? And so a psychometric approach would try to determine where you fall on the continuum in those personality dimensions. Psychological tests can tap into a number of different concepts. So first, intelligence testing. So if you've ever taken a test or heard the concept of IQ, the intelligence quotient, that is measured by using these intelligence tests such as the Wechsler scales. So the Wechsler Adult Intelligence Scale, or the Wechsler Intelligence Scale for Children, the WAIS and the WISC, or the Stanford-Binet. These are very, very commonly used intelligence scales. And you see these images here. These are blocks. That is one of the tasks that the Wechsler scales ask you to do. Basically, you have these blocks here on the left, and you are supposed to assemble them to match this picture that you're given over here. And that measures spatial reason. Other examples of subscales on the Wechsler scales, you might ask questions pertaining to general information, comprehension, arithmetic. You might look at similarities and then also vocabulary as well to come up with some kind of score that is going to be indicative of this person's overall level of intelligence. There are other types of psychological tests as well that you may use. So projective personality tests. Projective personality tests such as this image shown here, which is similar to a Rorschach test or the inkblot test. With projective tests, the idea is that the client is presented with some kind of ambiguous stimuli. So ambiguous means it could look like anything. It's open to interpretation. And you then ask the client to describe what they see. And the idea is that the client will project, take his or her internal conflicts, internal struggles, unconscious thoughts and desires, and put them onto describing the ambiguous stimuli. So with the Rorschach, you would present the client with a card that looks like this and say, what does this look like to you? And you might say, oh, it looks like a monster. And then I would say, okay, what makes it look like a monster? And I would say, okay, so these are the eyes right here. These are the eyebrows. These are the arms. They're placed on the monster's hips. And these are the big feet for the monster. And then you have a scoring manual that helps you determine what those particular responses mean. Other examples of projective tests include the thematic apperception test, or the TAT, and the sentence completion test. So we'll talk about the TAT in a second here, but the sentence completion test, you basically give the client some kind of open-ended prompt and have the client fill in the blank. So you might say something like, the sentence is, all women are blank, and then have the client fill it in. So if the client says, all women are not to be trusted, that might be indicative, right, that the client has issues with trusting women. Maybe the client has a history of abandonment by women in trust. The TAT, or the thematic apperception test, is another projective test, and in the TAT, the client is shown a series of cards that have ambiguous situations on them, such as this card here. And you ask the client to make up a story about what's going on here. And then based on what the client says in the story, that'll give you some insight into what is going on behind the scenes for this particular client, what's going on with them unconsciously. Other psychological tests, these are more objective tests, so self-report personality inventory like the MMPI or the Minnesota Multiphasic Personality Inventory. This is a series of 567 questions that the client answers true or false. Okay, so they answer specific written questions. There are predetermined scoring criteria, and there are a number of subscales on this. So for example, there's a depression subscale, there's a paranoia subscale, a social introversion subscale. And the problem, the one good thing, we'll start with the positives here. The one positive is that, this test has been normed, right? It's a standardized test. Everyone gets the same information, and then we can compare your responses to what, the thousands of other people who have already taken this test said also, to see how normal or how typical your responses are. The problem with standardized psychological tests is that there's a fixed number of responses, right? So the person can only answer true or false to the question, and that response may not accurately assess the individual. And additionally, we have problems with social desirability. Individuals might give you the answer they think you want, so they might not always answer. Okay, so other kinds of psychological tests, we could actually have laboratory tests done. So laboratory tests, we can have EEGs or electroencephalograms or MRIs. Basically, both of these are looking at activity in different parts of the brain, okay? And with an EEG, which measures brain waves, abnormalities might indicate that there's some kind of brain tumor or some kind of condition going on with your brain that could be influencing your abnormal behavior. With an MRI, this involves magnets, right? A magnetic field around the patient, and it uses radio waves to detect abnormalities, and it produces a very clear picture of the brain. So that's what you see down here, a picture of the brain as a result of an MRI. And then finally, we can use observation to learn about our clients, to come up with some kind of assessment. So with observation, you basically watch a client, and this can happen in a naturalistic setting where you watch the individual in a setting where they don't know that they are being observed. So this could be, watching a client. Let's say if you're working with little kids, watching a client in a classroom and the child does not know that you're there, watching what they're doing, or watching them on the playground. Controlled settings, though, you bring the client into a laboratory setting, such as in the picture down here. You bring a client into the laboratory setting, and then you can observe the client's behavior there. The upside to naturalistic observation, oftentimes you can get a better picture of what the client typically does. If they don't know they're being watched, they're less likely to change their behavior. The downside is that things can happen that you can't control for in a naturalistic environment. So if you're observing a kid in school, what if there's a fire drill, and that kind of throws off your entire observation period? In a controlled setting, the upside is that you can control exactly what happens to the client, exactly the experiences that the client has while in your care. The problem is that in the controlled setting, clients often know that they're being observed, and so they change their behavior.